Well, thank you so much for joining us on the AWS Milwaukee Meetup,
My pleasure.
10-minute point of view. So it's a real pleasure to have you on and really learn more about Cloudticity. Now, I know you founded it around 10 years ago, and I'm just curious if you could take us through that period, a little background of yourself, how you conceived of the idea, built the business model out, and ultimately where you are today, 10 years later.
Yeah, for sure. So my background has always been in technology. I've built a few technology companies. So I started Cloudticity in 2011 with the singular mission of helping healthcare organizations be successful on AWS. There were a lot of things that were happening at the time. So the federal government had just passed the HITECH Act as part of the economic stimulus recovery package under President Obama. That, amongst many things, required healthcare providers to begin digitizing healthcare data. And so we saw this gigantic proliferation of information being produced out of the healthcare industry. At the same time, the Affordable Care Act, otherwise known as Obamacare, was changing the way that health insurance payers were behaving. Prior to that, health insurers could exclude about 3 out of every $4 that came in claims as pre-existing conditions. Overnight, we saw healthcare payers change their behavior and look to become partners in their members' health as opposed to adversaries trying to deny claims. The only way that you can effectively, find the 5% of the patients in America who consume 50% of the medical spend is to do things like big data collection on 350 million Americans, very large-scale data analytics. And the third thing that was happening is, everybody started wearing Fitbits and wearables, and the FDA, shortly after we started the company, approved the first subdermal continuous glucose monitor. So our bodies began producing this incredible amount of telemetry. And so, there's this massive explosion of data driven by regulatory issues, social issues, genomics technology, the ability to do sequencing. The price came down to the point where consumers can afford it. So what do you do with all of those data? But machines were getting much less expensive. So machine learning that was unthinkable 10 years prior, all of a sudden became practical. But what we saw was the only effective way to do that was to leverage cloud. So the other phenomenon that was happening at the time was cloud computing, particularly driven by AWS, suddenly became a viable approach. And driven by social factors, regulatory factors, technology factors, it was clear that building a business that helped efficiently, effectively, cost-effectively, securely help healthcare organizations leverage that technology to achieve, what the law was asking them to do, but more importantly, to achieve better health outcomes for their patients. It became not only a viable business, but a super attractive business. So our vision from day one has been to make every human on earth healthier through the work that we do.
I love it. I love it. Why did you decide to go AWS as opposed to the other options?
So, in 2011, there really was no other option. And so, we were very early adopters. There was a lot of fear in the early days, and, CIOs and compliance officers and security officers were reluctant to trust healthcare data outside of their four walls. But AWS partnered with us from day one. We were members of the APN, the partner program from day one. They were great at helping us, broker those conversations with our clients. The technology is fantastic. It was 11 years ago, and it's 1,000 times better today. So it was kind of a crazy bet at the time, but in hindsight, we made a great choice.
Excellent, excellent. I know you were the first to achieve the healthcare AWS competency, and I think you actually were participating in some of the constructs of it initially.
We did.
As it was being conceived.
Yeah.
And I mean that's quite an accomplishment. So where's this showing up in terms of your ability to help customers? Can you walk us through the success that you've had most recently with a customer, how they really benefited from Cloudticity?
Yeah, we've got a lot of case studies published on our website. We've migrated some of the largest health information exchanges onto the cloud and made that a viable platform, dramatically reducing costs, improving security, availability, reliability. But what most of our customers quickly tell us is once they recognize those cost savings, what really floats their boat is the ability to move fast. When you're in a physical data center environment, you can't stand up a supercomputer's worth of computers, try a new machine learning algorithm for 15 minutes and tear it all down, right? So things that just were impossible to do prior to their cloud migration, they become almost commonplace. One of the favorite quotes of one of our customers, their chief solutions officer, said, when we started working with Cloudticity, things that used to take months now just take moments. And that's really indicative of the kinds of things that you can do by moving to the cloud. So we've seen customers build machine learning models that are directly identifying patients that need help. And we're seeing lives saved. We're seeing connections being made between health systems that never would have been made before. We're seeing dramatic reductions in readmissions to hospitals for common health ailments like congestive heart failure that are directly due to the ability that AWS gives us to test, fail and fail until we succeed and identify those models that work.
Excellent. How does a typical customer find out about you, and how do you typically then engage with them to help them and enable really good decision making about moving forward?
It's a good question. We're all technologists, and so we always have taken a technology first approach, which means for the first 9 years of the company, we didn't invest in sales and marketing. So it was a lot of word of mouth. It was a lot of good early successes, public case studies, partnership with AWS. In the past year, though, we've really ramped up our sales and marketing efforts. So we're just now starting to see that J curve happen.
Just in time for COVID. Tell us a little bit about what's going on in your world now with obviously COVID being such a major issue for all of us.
Yeah. So our clients are all healthcare. So every one of them is impacted. We're seeing a tremendous reach out of our existing client base asking for our help on an almost emergency basis, very quickly stand up analytics environments to do things like patient tracking, to identify who has intersected with whom so that they can figure out what an outbreak pattern is going to look like. We just started work yesterday with one of our health information exchange clients doing predictive modeling so that we can figure out which hospitals are in danger of exceeding capacity before it's too late, so that we can do dynamic rebalancing of healthcare workers. So, again, if we go back to our core vision of making every human on earth healthier through the work that we do, this is what we've been building for. And this is really our moment. So we're devastated by what's happening in the world, but we're really gratified that we're in a position where we can actually make a tangible difference.
That's fantastic. Fantastic. Well, Gerry, that pretty much sums up our 10 minutes, but I can't thank you enough for investing your time and walking us through Cloudticity and all the wonderful things that you're doing. How do we get a hold of you?
Cloudticity.com. It's CLOUDTICITY.com.
Beautiful. Hey, thank you so much. Appreciate it, Gerry.
Yeah, have a great day.
Thank you. Bye-bye.
Thanks. Bye.